Good morning, everyone, and welcome to our ASA information session, one of my favorite programs and team members to work with at Penn Medicine. We're here to share a lot of information about WIPSE, the ASA role, our program schedule, the application process, and a quick Q&A with our Penn Medicine leadership team. We should be done this session before 12 o'clock. The session will be recorded, so that way you'll be able to review again and we can share it out on our social media websites. If you are on camera, feel free to jump off. You'll still see myself and our manager of our recruitment and applicant experience, Morris, who, if you move forward in our program, he'll definitely get to know you and vice versa. A little bit about what we're going to talk about again today. Talk about WIPSE, Penn Medicine, and being an Access Services Associate, an ASA, our program schedule, the application process, and we'll give some tips on that application, deadlines, and then again, some Q&A. I want to slide too fast. Here we go. So a little bit about WIPSE, West Philadelphia Skills Initiative. We design and we run programs that connect you to the tools and the supports that you need to build a career that's meaningful to you. It's cohort-based training model, so it's one employer partner, our friends at Penn Medicine, and one job role, the Access Services Associate. One participant, one job opening. So our recruitment process can be really competitive, but we'll prep you for that interview so you could show up your best self to talk about your experiences and why you're the best candidate to join the Penn Medicine team. And of course, professional development and career coaching. Here at WIPSE, we engage employers in order to understand their workplace culture, hiring practices, turnover issues, desired applicants, to build out this customized solutions to meet their needs. So the energy that we bring to our participant relationships as our job seekers, we of course bring that same energy to our employers. Our goal is to build strong, trusting relationships with both. We'll listen to your pain points as job seekers and we respond to them. Our goal is to create a solution for you, the job seeker, to not just connect with a job, but connect with a career with an anchor institution in Philadelphia. How we do what we do, we study needs and we study job seeker needs. Then we build out that customized training program for participants. Again, not just for the job at the end of the tunnel, but for your career and your career growth at Penn Medicine. We reach out to the community through email blasts. Hopefully everybody signed up for our email blast for all of our recruitments and announcements from WIPSE. Community-based organizations, technical schools, social media. You can also follow us on IG as well. That way you're up to date on any of our announcements and all the great accomplishments that we're doing here with our employers and job seekers. And of course, we make successful matches. Graduates who complete our program are connected to full-time employment where they could be successful for themselves and also for our employer partners. Now I'm going to talk about Penn Medicine and the Access Center. Penn Medicine is dedicated to the mission of providing the highest level of care to patients, conducting innovative research, and educating future leaders in the field of medicine. Working for this leading academic medical center means collaboration with top clinical, technical, and business professionals across all disciplines. This line is from their website. Today at Penn Medicine, someone will make a breakthrough. Someone will heal a heart, deliver hopeful news, give comfort and reassurance. Our employees shape our future each day. The Penn Medicine Access Center is the largest cost center within Penn Medicine. They have over 300 employees who take over 4 million calls annually, supporting 30+ practices. The calls they handle are any reason someone might call a doctor's office, to make an appointment, update insurance, or talk to a provider. For this program, Penn Medicine seeks to hire qualified and devoted access services associates that can meet the demands of offering patient-first customer service. Now I'm going to talk about some highlights of the role. This is a full-time position with benefits. The starting salary is $17.69 an hour, but we know with prior experience, it increases that starting wage. You'll have a stable schedule, Monday through Friday, no weekends. I'm gonna highlight that, no weekends, Monday through Fridays. And that schedule could be 5, 8 to 4, 7:30 to 4:30. You'll learn your schedule during the onboarding process, but we like to call out once you get your schedule, that's your schedule. So we want to make sure you're available for that. You'll receive an access orientation program. It's a robust training program that we'll talk a little bit about later if our training staff is here, but that's where you'll learn their schedulization system and of course, receive your EPIC training. And another thing I want to highlight about this role, and that's why I enjoy it so much, the Penn Medicine leadership team, they really think about the growth of their employees. They created kind of a career pathway opportunity that depending on your tier, you're able to take on more responsibilities, work for different practices, problem solve and support other ASAs as you grow and move up, and supervisory and leadership positions. Now, some important things that you want to think about, hint, hint, these are some things you want to definitely include on your application. If you already submitted an application and you're like Lauren and Morris, I think I want it to be stronger, please reach out to the WIPSI email address. Morris is going to drop it in the chat. That way we can troubleshoot your application. All right. The best way to communicate with the WIPSI recruitment team is through email. So make sure you star us in your email too if you move forward with an application. So some of the desires that we're looking for in potential applicants: compassionate. Like I shared earlier, you want to make sure you're putting the patients first and have excellent customer service, okay? Patient empathy is a must. ASAs, you're scheduling appointments, you're dealing with insurances, individuals may be in crisis. It's like thinking about yourself as a patient trying to schedule an appointment with the doctor. Also, computer proficient. You're going to learn the EPIC software, which is typical for health systems, but you want to be comfortable with the computer. Know how to navigate to get to the internet, know how to work between platforms. You should have these experiences already. So that way, when you're learning this EPIC software, you're already confident with navigating that computer. Also, ASAs have to do a lot of typing, moving between the EPIC system to schedule appointments, update notes, utilize Microsoft Teams. We'll offer some of that support during programming so you're familiar with that software as far as Microsoft Teams and joining a meeting, but you want to make sure you're, again, comfortable with the computer. We do have a computer proficiency assessment as part of our recruitment process. So I want to make sure you're fully confident to navigate a computer. Of course, you must be interested in working in a call center environment. ASAs can take up to 60 calls a day, so you will be very, very busy, a lot of talking. So you want to make sure you're comfortable with that. If you have prior experience, that's the plus, but it's not required. If Chris Downing was on this call, he's a team member, a leader for your training as an ASA. He'll talk about his history. This isn't something he did before, but he enjoyed kind of being on the phone and working at this high pace level. So you definitely want to be comfortable and interested in being on a phone and kind of a call center environment. And of course, verbally warm, engaging, and articulate. Maybe not as loud as me, but you want to make sure you have that patience and that passion when you're talking to patients when they call. A solid service background, okay? Again, this is a high pressure, fast pacing environment, so you want to make sure you keep up. The great thing about the Penn Medicine team is that you'll have a lot of support during that training period. Some other things that Penn Medicine requires: a high school diploma, GED, to be tobacco-free, and the COVID vaccine and flu vaccine are required. We get a lot of questions about that. Feel free to reach out to the WIPC at email. If you look at our marketing materials, our COVID vaccination date, where we need that first dose, if you don't already have it, is laid out there. But if you have any questions, let us know. But these are the requirements we have, so that way you're successful as you move through that onboarding process. Now I'm going to talk about the calendar. This looks like a lot of activities, but this is the 3-week program to get you ready to start at Penn Medicine. Our recruitment is active now, and it ends June 21st at 5 p.m. into business. Again, if you've already submitted an application and you're like, Lauren Morris, I want to submit something else, I left out some customer service experience, please email us at WIPC. In the subject line, it's best if you write ASA inquiry, so that way we know exactly what you're talking about and exactly what you need, so we can solve it in a timely manner. If you move forward with us, you'll participate in some recruitment activities. It's a very quick turnaround. So again, star us in your email, respond to us. Sometimes it's enough slots. Those slots go by pretty fast. So you first come, first serve. So you want to make sure you're really active in checking your email with us. If you move past our recruitment process, we'll invite you to a participant agreement meeting. That'll be on site at WIPC. It's an opportunity for you to meet other members in your cohort who has the passion to help patients and work at Penn Medicine. We'll share the expectations of the program. It is a 3-week commitment, and you can't plan to miss any time. Our program is intentional. We want to map out that if you start as a new employee at Penn Medicine, you can't miss any time, because you're learning so much information and you haven't accrued that time yet. So we want to make sure you're on time, you're engaged, to really take in all of information about your growth and then also your next career step at working in Penn Medicine. For the 3 weeks that you are in program, you will receive a stipend. It's not a salary, but we offer $150 a week that's going to be on a preloaded card from our programming team for participating fully in our program. After you have your interview with Penn Medicine Access team, we'll have our closing focus group. One is a celebration for you graduating our program, meeting the commitment and our commitment to you. And then we'll ask for some feedback on the program so we can continuously improve. And the best way to get that feedback is from those who complete the program. We'll also support you with onboarding if you have any questions, so that way you're prepared for your start date at Penn Medicine. My last slide before I stop talking for a little bit, y'all, is just talking about the order of operations as an applicant. The first thing you want to do, of course, you're attending this information session. So thank you so much for joining us this morning. Again, learning about the role, able to ask a few questions, which you can drop in the chat. Morris is going to help me out and make sure I don't miss any of those. And hopefully you learned some information about Penn Medicine, WIPC, and of course the ASA program. You want to submit an application. Customer service experience is key for this role. So if you're submitting one-worded answers in your applications for any WIPC programs, I'm letting you know right now, you can't move forward. We only know what you tell us about you, your career goals, why you want to participate in your experience, okay? So you definitely want to make sure you give a detailed application. During our recruitment, we do not collect resumes. You'll leave our program with a targeted resume for the ASA role, so we'll collect your original resume down the line. You have to do your application as if we've never seen your resume, we don't know who you are, and what skills and experience you can bring to the program and to the Penn Medicine team. You really want to call out that customer service experience. I'm repeating it a lot because I can't say it enough. You want to make sure you write that out in all your responsibilities. Again, if you're like just customer service in one word, you're not going to move to the next level. So you definitely want to make sure you're thoughtful in your responses when you submit that application. Then you'll be invited into our WIPSI interview day, where you'll complete a WIPSI interview with us, and then also some assessments. Again, it's about classroom management, making sure you're ready for that training component, and of course, computer proficiency. We'll also collect some onboarding docs. And the reason why we collect that is when you move to that onboarding process after you receive your conditional hire, we want to make sure you have your high school diploma, you have your ID, you have your social security card. That way it's no delays with your hiring date. Again, everything is intentional. Of course, our participant agreement, that's the meeting that I shared earlier. Again, an opportunity for you to hear from us what the commitment is, and you to let us know if this commitment over the next 3 weeks works for your life. Then we'll have our professional development, which is 3 weeks of professional. We're focusing on your professional branding. We're doing scenarios of the call center. We're doing a resume with you, mock interviews, interview coaching, career coaching, growth mindset, effective communication, being open to feedback, receiving feedback. I'm sure I'm missing a few of the topics over the 3 weeks, but I just want to give you a little taste of so many things that we're going to pour into you, so that way you're not just successful during the interview, but your career pathway. And of course, your interview with Penn Medicine. So I know I did a lot of talking. Before I jump into Q&A, really fast, if I can get to it, I just want to talk about the calendar one more time because this question comes up often. Again, the application the last day is the Friday, the 21st, 5 p.m. If you move forward, if I request, as you can see on this calendar, you'll have to the 11th to really have these activities, so we move pretty fast. We'll have a participant agreement meeting July the 11th, and then classes will start July the 15th in person at our WIPSI office. So I'm going to stop my share. Oh, hey, Christy, I'm sorry. I was trying to get to you early in the presentation. I didn't see you.
Here I am. Hi. I've only been here a couple minutes.
Okay, good. So now we're going to move to the Q&A, everyone, with our Penn Medicine team. If you saw me shouting out people earlier, I see Christy, I see Marie, I see Angela from the HR Talent Acquisition team. The first question I do have, hold on, let me get to it.